All right, y'all, let's finish up chapter 3 now. We're going to start with chapter 14 of our ICD-9 manual, and that is for congenital anomalies. And these are things that happen during the birth period. Congenital means at birth. You can have congenital anomalies can be present at the time of birth, or they can transpire later on in life. Okay, and they are 740 to 759. So make sure you know that. Now for a birth admission, the appropriate code from category V30, single live infants according to the type of birth, should be sequenced. That's the principal diagnosis, followed by the actual congenital anomaly that the baby has. Now this is on the newborn's chart, not on mom's chart. This is the baby's chart. Okay. Now in chapter 15, we have the newborn perinatal guidelines, and they go from 760 to 779. Make sure you know what we should do when coding from this particular chapter. If you cannot remember, you have all the rules right here. Okay. Now, in chapter 16, you know we said that we do not like to code signs and symptoms, but being a physician-based coder or profi coder, you have to tell me what it is you want me to code. If you do not tell me and give me a definite or a definitive diagnosis, I'm going to code those confirmed signs and symptoms that patient has. So if you tell me that the patient is coming in with a cough and a fever, and this is probable pneumonia, and you never give me a definite pneumonia, I'm going to code those signs and symptoms of a cough and a fever. So definitely. But you also remember that in real life, query your docs. Make sure you have an open relationship where you can query your docs. All right. Injuries and poisonings. All right, y'all, the big guns. Fractures, and we talked about earlier, when you have a fracture and they don't state whether it's open or closed, our default is to closed. Okay, make sure you know that fractures and trauma, they are the head of the food chain. They're coded first because you're disrupting the human body. You've got some type of injury. And when you code an 800 or a 900 code, you have to have that appropriate E code, that external cause code, to tell the insurance company what has happened, because the insurance company needs to know exactly who is responsible for that bill. And the E code tells that. It tells that it happened at home. It tells that it happened at work. It tells that it was an accident, whether it be an automobile, or on-the-job injury. Because you have different types of insurance that cover different types of accidents, and we need to prove who is at fault and what actually did happen. So that is in the acute care phase of care. Now, if you have a treatment that is going to be treated in the subsequent phase of care, and it is a fracture, no longer will you use those 800 codes. You're going to use that aftercare codes and these are actual V codes. If you can see right here, so they are in the healing or the recovery phase of care. So make sure you know that. Burns, burns, burns. Now you all, burns, not only do you just code the site and the degree of the burn, but you have to code the total body surface area that the patient experienced as well. So it takes 2 codes to actually code out your burns, okay? So always code right here. Look here. Make sure you go by this, you all. The highest level of burn is always coded first. The highest degree of a burn is always coded first. And here, make sure you know this chart right here for your total body surface area. Make sure you go through and you look up that. Now, the next thing we have are poisonings. Poisonings are in our adverse effects and toxic effects. Note this in your table of drugs and chemical. When you have an adverse effect, that means that they gave the drug correctly, but the patient has some kind of reaction to it. And when you come to think of it, that's the only way we know if we're allergic to something or not. We have to have an adverse effect to it. But if you have a poisoning, you may have taken some kind of narcotic, some Loratab, and drank alcohol with it. And then you face some kind of effect that is a poisoning. You should not drink alcohol and take those type of drugs. If someone puts something in a drink like that Rohypnol, that is assault. Actually, that is assault. Somebody has given you something that you were not aware that they were giving you. So make sure you go to your table of drugs and code these things. Okay. All right, make sure you know where your guidelines are, you all. You know where your E codes and your V codes are found. And we've talked about these going through. So make sure. Here's your glossary of acute, chronic, closed, fractured, E codes, first degree burns, late effects, open fractures. Make sure you know all of this terminology, you all. It's found right here. If you can't remember it, put it in your book. And here are your chapter review questions again. If you want to go through and review these, make sure you test yourself and that you feel comfortable. This can be used as a good study tool as well. All right, you all, that is it for chapter 3, part 3.